in this part, we're going to be talking a little bit about how were your symptoms after you finished your antibiotics?
So now it's my favorite part. I feel like your favorite part is like life after SIBO. So kind of after you've completed treatment, kind of how has your symptoms been feeling? Because I know you're kind of in it right now. I feel like
Yeah.
this is a good thing for everyone to hear about is your experience, after just kind of completing your SIBO treatment.
Yeah. So we're recording this in March of 2025, and I think I completed my antibiotics around the first week of January.
Okay.
So it's pretty recent. From what I had learned prior to that, I had heard that you probably won't feel symptom resolution like right after the last day of your antibiotics. Like it might even be a couple weeks after, or if we're maybe it had to do another round of antibiotics. Like I don't really know. So for me, I completed my antibiotics first week of January, and then probably the couple of weeks afterwards, I was still not feeling great. I was kind of doing that FODMAP gentle approach, still having kind of those orangey loose stools that I was dealing with in the beginning. And it was, I was really just kind of like, okay, I just need to stick with this. Like, I don't want to jump right to doing like another breath test or another round of antibiotics. Like, let me see if I can just like, if it's taking its own course, like giving it a little bit more time. So I was doing the things. I was staying hydrated. I was trying to eat lower FODMAP prebiotic rich foods. I was really, really trying to prioritize doing yoga, meditation, anything that can really help with my nervous system regulations, like even spending time in nature, going on walks, like that was a big one for me.
Yeah.
And then I started to see some improvement. I think personally, like I know, it's been a couple months since January. Like I think I still kind of am in that recovery period. Like it takes time.
Yeah.
Happy to say, like most days I'm having like pretty normal bowel movements, and at least the color has corrected, which I think is a big green flag for me, because like that's kind of scary. Like if I'm like malabsorbing fat all the time, like I can get really deficient in fat soluble vitamins. So
Your hormones, so important.
yeah, and then like there were other things that I tried too. So in the beginning, before I did a lot of testing, my doctor recommended that I try psyllium husk, like a fiber supplement, to see if it made much of a difference. And I didn't see a huge improvement prior to treatment, but I tried it again after treatment, and I made it a huge difference. I think that really helps to just kind of like bulk up my stools a little bit. Like if I was having too fast motility, I think it helped to kind of just like slow it down and make it a little bit more viscous. So that was a big change for me. But there are days where I'm still like, okay, like I had like really loose bowel movements, or I'm still having a couple episodes of like bloating and distension, or like kind of abdominal pain here and there, but it's much less. And I think I'm just kind of like figuring out if there were any like foods that are a little bit more triggering for me, that are kind of like that I'm able to identify for this new period of my life. And it might not be like that forever. I think we have to remember too, like SIBO itself throws off our gut microbiome, and then antibiotic treatment throws off our gut microbiome. And so it takes time for your gut microbiome to kind of like restore and kind of come back into balance. And I think like as I continue to support my gut microbiome, hopefully I continue to see improvements in my GI symptoms. But that was kind of my experience. I know you mentioned like having quite a bit of time in that treatment zone. So like when did you know that things had gone over to the other side? Like we're finally in recovery, finally seeing that change in your digestion.
I would actually say probably, around 3 years ago when I started to really see the change. And for me personally, that was really working on my relationship with food. So really starting to diversify my diet, really starting to have more joy around food, starting to spend time with family and friends, not really thinking about with my symptoms kind of what was going to happen. And there definitely was periods of uncomfortability. There were times where I did go kind of beyond that threshold amount, we like to say, for garlic and onion, and I really was painful and it didn't feel as good. But now I will say that there are times where we have periods of bloating, and now we just understand things more. We understand more about our personal body, but it's so much less and really infrequent now. I don't even notice when I bloat, which is crazy to say because at one point bloating was like my daily struggle.
Yeah.
But during that time, it really was starting to kind of identify, specific triggers. And for me, I noticed very quickly that movement and stress management were huge things that I had to kind of integrate to kind of start turning that corner. So really starting to find little moments where I was like stress relief, and maybe it wasn't meditation all the time, maybe it wasn't deep breathing, but sometimes it was just like watching a TV show, hanging out with my family. Those are also kind of things of nervous system support as well. So kind of just feeling more present, at meals was really important. And then movement, so gentle walking was a really big thing that really was starting to
Yes.
help motility. So kind of but that time it can be frustrating, especially without guidance, which is why we have so many amazing GI dietitians now, and it's so exciting because I think now patients will be less in that kind of healing space alone. Now they're going to have someone walking with them, which is so important.
Yeah. And I had a question too, also submitted about like retesting. Like I know that you had a couple SIBO breath tests, and I don't know if you want to share a little bit about that experience, and then maybe we can kind of discuss like, do we need to retest to kind of confirm that that SIBO is under control?
Absolutely. Yeah, I definitely had about 3 SIBO tests that were done kind of intermittently, kind of through that 3 years kind of there. And the reason that I kind of kept retesting with my providers was I wasn't getting better. So
Yeah.
my symptoms were still present. And I think that was still kind of showing I needed to continue to work on getting in that consistent nutrition. Diversifying my diet can take a long time to diversify and to feel
Yeah.
comfortable. The stress around that experience, the anxiety, the fear around food can take a long time to kind of work through that. And this is when I started discovering really amazing dietitians as well, like Kate Scarlatta, and people that were really showing me that like there is a future, where my symptoms weren't dictating everything. So it was really exciting to see that. But when it comes to retesting, I say, if we're not seeing any more symptoms, if we feel like our symptoms are getting better, I don't think it's necessary to retest as much. I think that
Yeah.
if we are continuing to see symptoms like how I was in my personal experience, then kind of retesting after a certain period of time, working with your provider to decide that when's the best time to do that, I would say is probably the best approach. How do you feel about that?
I agree. I think like SIBO itself is a very symptom-based diagnosis. So like if we have control of those symptoms, then we
Mhm.
can probably say, okay, like it's likely very much under control. And I think overall gut health, I think like people kind of want to know, is my gut microbiome healthy? Do I have good gut health? And those are good signs. Like, are you feeling like uncomfortably bloated and like abdominal pain? Are you having like constipation and diarrhea? Because those are signs of like, okay, maybe your gut health isn't optimal.
Yeah.
um but like having resolution, less bloating, more normal bowel movements, those are all good signs that you were having a little bit more balance in our gut microbiome,
Yeah.
including like where those bacteria are living, so hopefully out of the small intestine more into the large intestine where it's supposed to be.
Yeah, absolutely. I find that if we're noticing, like kind of like you're saying, your primary symptom, it's going to be a little different maybe for everyone. For Emily, it was bowel regularity. For me, it was more bloating, but kind of whatever you feel like your primary symptom is, if you feel like that's improving and you're noticing you're going through days and you're feeling less of that, that's usually a pretty good indication things are going well.
So after you kind of had that resolution, and even now, like you're 3 years out from feeling like you're in that kind of recovery phase of SIBO,
Yeah.
what are you doing now to kind of continue to take care of your gut health to prevent recurrence
Yeah.
and just like continue to feel good?
Absolutely. No, I love this part. It's so important. So for me, I find, my biggest triggers, are stress. Stress is a big one, and we all notice it causes changes in our motility. So I do find that, whatever your routine is when it comes to stress management, and it's not always going to be perfect, we always know that some days are just going to be really stressful, but finding what works for you, that's kind of what's worked well for me. So for me, it's, reading, it's gentle movement, walking, getting outside into nature, when I can, trying to take little breaks outside, that's really important for me personally. And then consistent nutrition throughout the day. So kind of eating every 3 to 4 hours has made a huge difference in my energy levels, my motility. I feel like I have no issues, thank goodness, from like the bowel regularity side, the bloating side. When I do notice my bloating as well, I don't get scared anymore. I think
Yes.
it's important to also address our thoughts around things too. And sometimes it's saying to the brain, like, I've made progress. So when we get that twinge of fear of like, oh my goodness, I'm feeling my symptom, is it back? What did I do wrong? And it's like, the brain is wired. It's going to look for those threats, but kind of just saying, I've got this. I have my habits. I know what I'm doing. Just really supporting your motility, supporting that stress management, and chewing at meal times. All these basic, like really fun things that everyone loves. I know we joked about on my podcast like last week is the unsexy basics of just like
Yeah.
supporting yourself. I think that's the most crucial stuff when it comes to SIBO is really just supporting the basics there.
Yes. Yeah, absolutely. And I think very similar for me too, as I mentioned, I still feel like I'm coming out of that treatment phase into the recovery. Um, and so I really am just trying to kind of continue those things because I think like while I was taking my antibiotics, like I was very serious about like staying hydrated, like, you know, proper nutrition, the consistency of those meals throughout the day, like, you know, stress management, exercise, all of those things. And I don't want that to be like a temporary thing for me, like just while I was in treatment. Like
Yeah.
I'm hoping to kind of continue to carry those over, prioritize all those things that I know will be helping my gut health, whether I have SIBO or not. Like those are all great habits to have. And I think the biggest thing, once again, like I agree with you with the stress management and like having that be a big trigger for me. And I'm really trying to be intentional about like setting boundaries around work, especially working from home.
Yeah.
Like it's really challenging. So I think that's a really big one, or just finding like little ways to like reduce my stress, whether it is like time with friends and family or some sort of movement. But that's kind of my approach. And as silly as it may sound, like food safety, because I
Yeah.
genuinely think like the food poisoning was a big part of my like getting SIBO in the first place.
Yeah.
So, and like whether or not, like it's, you should always be safe with food. So like I'm trying to be really conscious about, okay, what water am I drinking? Like when I'm traveling, like should I be eating this food, or, you know, making sure things are properly cooked or refrigerated or whatever too. Like it's honestly really important, food safety. So I'm trying to keep that top of mind for myself a little bit more too.
Absolutely. And I always like to say with when it comes to we're going to have little flare-ups in our GI symptoms. So say like especially when it comes to SIBO, I know a lot of clients and myself as well. There's always that fear of recurrence, you know, of like it's going to come back. And it's really starting to like give yourself compassion and also remind yourself that some bloating is normal. So like
Yes.
bloating, especially after we had like fiber-rich foods, like prebiotic-rich foods that are all incredible for us, our microbes are going to produce some gas. There's going to be some bloating there, and starting to see the difference on how that feels in your body, of how normal bloating feels versus SIBO bloating, if that's something you
Yeah.
had with. So kind of starting to also see that difference, I think also is comforting as you kind of get out of your treatment.
Yeah, and I think like a lot of times when you're experiencing something like SIBO or like the whole treatment process, like you are kind of forced to pay attention a little bit more. You can become like hyper
Yeah.
attuned to your body, but like maybe sometimes too much, sometimes not enough. We kind of want to find that like in between where we're listening to our body's cues, we're listening to our hunger and fullness cues, but we're also like very much aware, like you mentioned, of those differences between like normal bloating and like this is painful SIBO bloating, or even like bowel movements. Like, is this normal for me? Was it just something, you know, like, oh, I know I had like a little bit of a triggering food the other day, or is this something totally out of the blue?
Yeah.
So I think that's something too, is the like how much you're listening to your body, and then like that relationship with your body, hopefully like strengthening that in this process, because like you can't hate your body while you're trying to take care of it. Like you really need to give it that love and compassion and care, and be patient, because it takes time for things to change, whether that's SIBO treatment or anything else you're really trying to change within like your own health journey.
Yeah, absolutely. I love how you kind of said that. I feel like it's like the analogy of like your body and you are on the same team. Sometimes
Yes.
like your
Yeah.
team member that day, and that's okay. You know, sometimes
Yeah.
we're allowed to be frustrated, especially if we're feeling things. But at the end of the day, being like, okay, showing yourself compassion, realizing you're doing everything you can, like how you're doing with your movement and the stress management. And even if it's 1 or 2 minutes, maybe it's not exactly what we planned it to be that day. But even if
Yeah.
it's something, that's really important too. So I
Yeah.
think
So I guess, you know, what are your biggest reflections and like maybe lessons that you learned even now? I mean, you're a dietitian and you went through all of this before you had done your nutrition education and training.
it's
Like, what do you feel like is the most valuable thing that you learned and kind of pulled out of that whole SIBO experience?
Yeah, there's so many. I feel like the biggest lesson I had was like really listening to my intuition in my body and learning what it needed. Like you said, like you know that something's wrong. And like
Yeah.
that connection of kind of going through something and really advocating for yourself,
I'm gonna
coming
say, like, you advocated for yourself so much in the beginning to even get a SIBO breath test. Like, that is huge. And like, trusting your intuition.
Yeah, absolutely. And I feel like so many of our clients come in that position where they've really advocated for their symptoms. So kind of building that trust with your body. And, now I feel like the SIBO diagnosis, I say it honestly changed my life in a weird, way, in a kind of roundabout way is, I don't think I would have maybe known the path of a dietitian and kind of gone to this path if I didn't go through SIBO. So in a weird way, I've always been thankful for SIBO being there because I think it kind of brought me to this point, and I absolutely love what I do, and I love kind of our conversations around this because I think it's so important for people to not feel isolated with their symptoms, especially if they're the only person in their life maybe dealing with this. In our little GI community, we have so many people who we know who kind of dealt with this, and like you and I as well kind of talk about this, but just making sure everyone knows that like you're not alone in your GI symptoms. You have people who really want to help and kind of help you guide you through this path. But that was kind of my biggest takeaways of that. What has been your biggest takeaway so far from your journey, especially with it being recent?
Yeah, I think I agree with you. Like, SIBO has obviously been very life-changing for me, as much as I don't want SIBO and do not want to go through that again. But
Yeah.
um, it has allowed me to have a lot more sympathy for what my clients are going through, especially with like the frustration and of getting a diagnosis in the first place, and
Mhm.
like all the testing, and like even just like I think like the clients that I have, I'm like, oh, like you've had endoscopy, colonoscopy, right? Like it's just like such a common thing that my clients have had done. We're now going through it myself. I'm like, oh, like that sucks. Like that is not a fun thing to do. And like so many of my clients have had to do that, especially very young. Like
Mhm.
colonoscopies, okay,
Yep.
that's normal maybe once you're in your 40s and 50s. A lot of people have to go through that, but like
Yeah.
most of my clients are in their 20s and maybe 30s. Like
Yeah.
it's kind of crazy how many people have done that. And so now I kind of like can relate to their experience a little bit.
Mhm.
So that's brought me I think a little bit better connection or understanding when I'm working with my clients. But also I think it's really interesting on like kind of this whole conversation. Like, okay, yes, I have a little bit of this, I can relate now, or I have more of the sympathy, but I cannot say that I can fully understand what they're going through because everyone's experience is so different. So
Yeah.
yes, I can give them a little bit of like, hey, I've been there, or like I'm here for you, but what they're going through is what everyone's going through is so different because there's other things going on in their lives. Like you and I both kind of shared how our symptoms presented differently and kind of like what was going on in our lives at that time that really maybe kind of pushed this into happening. I'm trying to keep that top of mind now that like it's not always textbook, that everyone's experience is really unique.
Yeah.
And just kind of like listening and being open-minded to like what people are saying that they're going through.
Absolutely. And this is where I am going to shout out my dietitians, the whole dietitian community, because I think that a lot of us have personal stories kind of coming into
Yeah.
why we chose this, but the difference is that our story is not the way we're treating. The way that my SIBO kind of had to happen is not how I'm helping people. We have the
Mhm.
knowledge to look at everybody individually,
Yeah.
and kind of take us out of it and kind of make the story more about what the client's been going through. And I think that's the importance of working with someone who has got the training, and the expertise of kind of going to school to learn, nutrition therapy, to learn all the different things, to kind of really from an evidence-based perspective kind of give that information and that guidance. So I do have to shout out my dietitians. I have to do that as well.
Yeah, and I think that's a really good point because, like, as someone with a GI condition going to seek out care from a dietitian, like, your dietitian does not need to have an experience with this, like, their own
Yep.
personal experience in order to be helpful, in order to be knowledgeable. So, like, that's okay. And now I kind of have to keep that in mind that, like, okay, because I've had a SIBO experience, that doesn't mean I know everything about SIBO. Like, I need to keep myself in check. Like, this person has had a total different life, total different experience. Like, I can think back on like what I remember from
Yeah.
my
And
experience, but like that doesn't mean that that's how I'm treating all my patients.
absolutely. We have the empathy, but it's like a new story. So
Yes. Yeah.
absolutely.
This has been so fun. I hope this was helpful in case anyone missed the previous videos. We kind of talked through our experience before SIBO, like what kind of led up to us getting our SIBO diagnosis. Then we talked a little bit about that SIBO treatment experience, like actually getting treatment, taking our antibiotics, like how we were feeling during that time, other treatment options. And then we talked a little bit more about like life after SIBO and just like what that looked like. Like, did we feel 100% right away? Were we able to, were there things that we were doing in other areas of our lives to help us feel better in terms of our GI symptoms? So check all of our videos
Yeah.
out, and thanks for listening.